Mike?
Hello? Okay, we're good to go? All right. Hello, test, test. Okay. All right, I think we're good to go. Sorry about the delay. Statement from the brokerage. I want to start out this morning by saying, first of all, that the brokerage is committed to ensuring that all Medicare beneficiaries have access to the accurate and impartial information they need to make optimal choices about their Medicare, healthcare, and prescription drug coverage. And we're concerned that changes to the current Medicare Plan Finder, though many are intended to aid beneficiaries in the plan selection process, may instead have the opposite effect because of limitations due to the process, timing, and accessibility of revisions. So our position here is that we applaud CMS and their efforts to improve the Medicare Plan Finder, which is CMS's primary enrollment assistance tool. But we do find it troubling that the Medicare Plan Finder's late August release may not give third-party assisters like you, brokers, or state health insurance program counselors adequate time to learn the new tool before the AEP begins. The Medicare Plan Finder launch timeline is likely to generate demand for enrollment assistance, and I do believe this will lead to brokers making a difference and leading, of course, to more enrollments. So while it may cause some confusion, there could be a little bit of a silver lining behind this cloud where, once again, brokers come to the effort and make the decisions for people and help them enroll. But first of all, let's talk about things like the quick review of the current Medicare Plan Finder. We're going to look at the new redesigned Medicare Plan Finder. And then we're going to talk about what's really behind all this, which is the eMedicare initiative, the mymedicare.gov website, and the Blue Button 2.0 technology. Then we may be able to offer you a solution, some tools to help you not only quote, but also to recommend prescription drug plans, and Medicare Advantage plans. And we call this system simply Enroll. So first of all, the current Medicare Plan Finder. This is a screenshot that I took just yesterday. And as you can see, there's a different look. As you can also see, the yellow arrow that I have where it says Find Health and Drug Plans. If you were to click that link, you would still find the same type of step-by-step process that you may be following now for Medicare Plan Finder quotes. So that's not really going to change. You will still be able to generate drug plan quotes, but unlike the one you see on your screen, which has the drug list ID here highlighted, this is a quote that I ran from someone just recently. This is what's going away. This drug list ID that you would normally use from year to year to pull up the client's drugs that you may have quoted the previous year or even 5 or 6 years ago, that drug list ID is going away and you will no longer be able to access those drugs. So the breakdown that we're used to seeing of where a person may hit the deductible or when they may hit the donut hole or even the catastrophic coverage, it may still function, but it's going to be more difficult because each and every time that you go in, you're going to have to re-enter these drugs. So this is the current system as we know it. So what's going to change? All of the saved drug list ideas are going to be removed around the end of September 2019, or at least that's what we're being told right now. There may be some changes to this, but as we speak, the drug list IDs are being removed at the end of September. Any new drug quotes must be re-entered, and after October 1st, no new drug plan quotes can be saved, which means if there's a drug change, for example, someone gave you an 80 milligram prescription when they really meant to have a 40 milligram prescription, the entire drug list must be re-entered each and every time there's a change. This could be very time consuming in an already very busy time during the AEP. So the redesigned Medicare Plan Finder will compare pricing between original Medicare, Medicare prescription drug plans, Medicare Advantage plans, Medicare supplement insurance or Medigap policies, and will allow someone to compare coverage options on their smartphones and tablets. So the redesign will be more technologically advanced to allow for different views, and in many respects, those same things that we enjoy today will still continue to be available tomorrow. The biggest change here is that if you have any saved drug list IDs, again, as I made my point a minute ago, those are going away. So the redesigned Medicare Plan Finder will allow you to compare up to 3 drug plans or 3 Medicare Advantage plans side by side, get plan costs and benefits, which include Medicare Advantage plan offer extra benefits like dental or vision or one of the gymnasium memberships or over-the-counter benefits. And it'll allow you to build a personal drug list and find Medicare Part D prescription drug coverage that best meets one's needs. And we'll get into that with the mymedicare.gov here in a minute. However, the problem is we're not doing a very good job as an industry of letting people know that this is about to happen. I think some of the brokers and partners that we work with are beginning to recognize that this could be a problem. However, I'm afraid that the Medicare beneficiaries are very unaware of what's about to happen. And if they're seeking advice from a state health insurance program counselor or a broker such as yourself, what they're going to find is that there's going to be a lot more confusion during the AEP just because there's going to be a lot of change with the Medicare Plan Finder. So what we try to do is get you to encourage anybody that you know in the press to become more aware of this, whether that's through the newspapers, the radio, TV, social media. If you've got a Facebook page, do whatever you can to make sure people are aware of these changes. I found a study earlier from Milliman, and I want to point out that, as you may know, if you've already completed some of your Medicare certifications, there are going to be some out-of-pocket changes. And one of the values of the Medicare Plan Finder is we get the TROOP, or true out-of-pocket, which is a combination of the drug plan premium as well as the cost for the person to buy their medications. And typically that's combined and gives you a solid number, much like what I showed you in an illustration previous. But this next year, the Medicare Plan Finder tool is not currently able to quote both the premium and the Medicare, the drug cost out of pocket. So you're going to have to do some manual calculations until there's a fix put into place. But in addition to that, next year, as you probably know, the out-of-pocket is going up, and a person may have to pay as much as over $6,000. So there's quite a big jump in the basic format of how a Part D true out-of-pocket is calculated. And unfortunately, we need the Medicare technology tools to be able to help us to quote that. And what we have had, which works fine, is going away. So my thinking is, if it ain't broke, don't fix it. But these are the changes that we're dealt, and we're going to have to figure out how to handle it now. So how is the new system going to work? Basically, through a couple of different technologies, you're going to start hearing a lot more about eMedicare, mymedicare.gov, and Blue Button 2.0 technology. So let's take a look at each one of these. First, eMedicare. Medicare is improving and modernizing the way you get your Medicare information. That's fine. We have the big data in the cloud and all the different types of technologies and devices that we use, and we're very accustomed in today's world to using technology. Medicare has been a little behind that. Now they're starting to catch up. So what is eMedicare? What does it do? Well, the goal is to provide a seamless and transparent experience to help you get the information you need to make good healthcare choices. Get improved health with your Medicare choices, such as making it easier to find health and drug coverage that works for you. My first thought was, well, that's what a broker does, is they make it easy for people to find health and drug coverage. And if they're going to involve technology that's going to replace a broker, immediately my concern begins to go up a bit. It allows people to compare the ways they get their Medicare coverage and explore how different plans work together. Again, this is the function and role of an agent. So could we use this technology to better improve the way we communicate with people about their different plan options? And then you can also shop and compare plans to find ones that best meet your needs. All of these initiatives are great. These are the things that brokers do on a day-to-day basis. What we're saying here is the eMedicare initiative is going to make this easier for people to shop plans, and possibly not with you as a broker involved in the picture. And I humbly submit to you that while that might seem like you're getting cut out of the picture, believe me, I think the more complicated things become, the more necessary you become. And that said, you could go right now online and go to a different website and purchase something and have it shipped to your house with Amazon, or go buy an automobile and have it shipped to your local dealership. But in most cases, you're going to research those kinds of major decisions before you make a decision. You're going to consult with a person. That's the way I see this playing out. You can also go to medicare.gov and /plan-compare and still get these ideas that we're talking about. So again, that's still going to be available. It's just not going to save the drug list. So you can still see estimated costs for outpatient procedures. You'll be able to compare national average prices for certain procedures, both inpatient and outpatient. And you can see that there's a price lookup website here at mymedicare.gov. This is an effort through eMedicare to make price transparency more available. I think we can all agree that it would be nice to know what the cost of healthcare is, and that does seem to be still a little bit of a mystery and a surprise. eMedicare will make it easier to get access to personal Medicare information, improving things by utilizing mymedicare.gov to make it easier to find what you need, added new features like the ability to print an official copy of a Medicare ID card, and then allow people to get connected to mymedicare.gov via the Blue Button 2.0 technology, which actually is a secure data connection that allows you to share your health information with a growing number of mobile apps, third-party apps, and health-related services and research programs. So we've all been talking about how important it would be to have electronic health records and have one facility talk to another facility, have one doctor talk to another doctor. That's what this is all about here. eMedicare initiative is going to help improve sharing data and health records from one source to another. Now, where will this all be stored? The Blue Button technology basically will allow for that information to be saved in the cloud and then downloaded into a person's mymedicare.gov account. So here's a screenshot of what the mymedicare.gov account looks like. Now, if you don't have a Medicare claim number, then you're not going to be able to register. There's not a sandbox that you can go and play in here to toy around and see what's behind the curtain. So if you have someone that you work with, maybe that's a close friend or a relative, and they're willing to share that information with you, we're going to get into the risk associated with that next. You'll be able to access their files and be able to see their claims data, not only their drug data, but also their health claim data. So this presents a little bit of a HIPAA risk, which is another concern that I want you to have, because you're going to have to store this information, and you're going to be responsible and liable if that information gets into the wrong hands. So the Blue Button 2.0 technology is what's going to fuel the information being pushed into mymedicare.gov. So let's take a look at what is the Blue Button. And as you can see here on my screen, you can go online to bluebutton.cms.gov, and you can actually view a lot of the different assets of the Blue Button 2.0 technology. And as you can see here where I have the yellow arrow pointing, it says Blue Button 2.0 from CMS is an API that contains 4 years of Medicare Part A, B, and D data for 53 million Medicare beneficiaries. So a lot of this information is already stored at mymedicare.gov. Many of the Medicare beneficiaries that you may serve do not know about mymedicare.gov and perhaps have never created an account. So this becomes another area where you may be able to better serve your customers by helping them to get set up and also be able to have their permission to access their health and drug claim data, which ultimately will help you to better determine which health plan and drug plan may best fit their needs. So what is the Blue Button 2.0? Medicare has released a new data service that makes it easy for you to share your Part A, Part B, and Part D claim info with a growing list of authorized applications, services, and research programs. You authorize each application individually, and you can return to mymedicare.gov at any time to change the way an application uses your information. So what this means is the Medicare beneficiaries are going to have the options to share their information with you as their broker. We all know that there's a lot of people out there in the world, especially those that may be 70, 75 or older, that might not be real comfortable with technology. Studies have been done where the new baby boomers that are aging in are very tech savvy up through about age 67. But as people turn age 68 or even older, in today's world, they're not as technologically savvy as the younger baby boomers. So you're going to need to be involved to help coach them through this system, which becomes another opportunity for you to better serve those people, to deepen your relationships with those people, and perhaps even show the value of a broker and how you make a difference in that Medicare beneficiary's lives. And I'm sure that they appreciate it enough that they're going to give you more referrals because of that. So mymedicare.gov and the Blue Button 2.0 technology, you can see a bit of a thumbnail sketch there on the left-hand side. Medicare.gov does a really nice job of explaining all the Blue Button technology, and I'm not going to get into all of that today. I do encourage you to take these resources and go do your own research and become more comfortable with what this means for you going forward as you dispense advice to Medicare beneficiaries. The mymedicare.gov Blue Button makes it easy for you to download your personal health information and have access to your information to help you make more informed decisions about your health care. And the Blue Button technology is safe, secure, reliable, and easy to use. However, here's the challenge that we face. Medicare beneficiaries must authorize the sharing of their information with an application by using their mymedicare.gov account information. Brokers like you can use that application to view past and current Medicare claims. For Medicare Advantage plans, only the Part D information is available at this point through this service. If you have a Medicare Advantage plan, you need to check with your plan to see if they offer a similar service to Blue Button 2.0. So what I'm hearing and reading and researching shows me that Medicare Advantage plans are involved, but it's not necessarily 100% yet. Not all carriers are up to speed on the technology. Not all carriers are able to properly feed the data, whether that's health claim data or drug plan data, drug claims. So for example, you fill up your lisinopril at Walgreens right now. If you have a prescription drug plan, Part D, it goes straight up into the big data in the sky, in the cloud, and bounces right back down into the mymedicare.gov account. We're not quite 100% there yet on all of the Medicare Advantage plan claims, especially as it relates to the health claims. But some of the Medicare Advantage plans are functioning with the drug plan claims. But there will be a transition period. We're going to have to get used to this. The Medicare Advantage plan carrier reps are telling us that they're doing everything they can to get caught up with this technology right now. Medicare keeps a list of authorized applications, and you can learn more by visiting medicare.gov and searching for the blue button. So go back to that thumbnail sketch I gave you a minute ago and do some research there. So from your point of view, you need to be asking, are there any HIPAA issues that need to be considered? And what risk does a broker take with a person's PHI and PII? We already know that there are a number of news reports that are starting to pop up, and you'll probably see a lot more of them over the next couple of weeks. And hopefully you'll take some of these same HIPAA issues to the press if you have contacts in the press, and spread the word about making sure that people are protecting their PHI and PII, and that anybody that's authorized to use that, such as you, does a good job of storing those things in a secure area. So news sources like Politico, they put out a very good article about how the Department of Health and Human Services wants you to give your health data, but the question remains is, do you want it? And how many people are really going to mymedicare.gov or will go to mymedicare.gov and try to utilize the services available? And then we see the new 2020 Medicare New Handbook, which is soon to be delivered, with a full page in there about encouraging people to protect themselves from fraud and medical identity theft. And there's even a reference and a mention of mymedicare.gov right here. So I don't want to say that there's mixed signals being given, but at the same time Medicare is telling people to protect their information, here you are trying to ask for that very same information so that you can help them. So I don't really agree with all of the changes that are being made, and I certainly don't agree with the timing of these changes, but fact is, they will be changing, and we really have to react to this very quickly. And you need to rethink your plan about how you're going to handle this HIPAA protected information. So some issues to consider. To log into a mymedicare.gov account, a person must have a Medicare number. They must put in their full name that's on their Medicare ID card, their date of birth, and an email address. And all of that's considered protected health information under HIPAA. But there are many with medical issues that are currently living in nursing homes or memory care centers, or who just never got into computers, who will not be able to deal with an online account. This is where a broker like you can really step up and make a difference and help that person with this information. So what HIPAA risks do brokers now assume? Well, if you get their password and their username to their mymedicare.gov account, then you're going to be liable for that information. But in order to really properly help them, you're going to need to have that information. So a rhetorical question that I ask for you to consider here is, how are you going to handle this? Why should you download and share your health information in the first place? Because by using the Medicare Blue Button and the Blue Button 2.0 technology to download and share personal health information, Medicare beneficiaries gain better control over their health information. They can make it easier to share the health information with doctors and other third-party caregivers, and they have better chances to help manage and improve their health through a wide range of apps and other computer-based services. So how does a Medicare beneficiary protect their PHI and PII? Since they control access to their health information, it's ultimately their responsibility to take the steps to keep it safe. But if they turn that over to you, then it is also your responsibility to keep it safe. So treat your personal health information the same way you treat anything else, like banking or other confidential information. And then we have seen in the last week or two, Medicare.gov sending out email notices to all Medicare beneficiaries that have registered to receive notices from Medicare, They're telling people to guard their information. So the question again, how are you going to help someone if you need to access their mymedicare.gov account? And at the same time, Medicare is telling people, be careful, don't give out your Social Security, don't give out your personal information. Then you stand up and say, well, for me to best assist you, I'm going to need that information. Kind of send some mixed messages and put you in a little bit of a predicament. I just ask that you consider, what is your liability and how are you going to handle this? Is there a better way to manage the drug plan quotes? How about you use our system called Simply Enroll? A lot of the information that we just talked about with respect to the mymedicare.gov username and passwords won't necessarily be required if you use our Simply Enroll platform. So what is this? Well, as you may know, for several years, the brokerage has offered a platform called Connecture. The technology will still continue to be provided by Connecture. It's just this year the brokerage has decided to co-brand the Connecture platform, and our version will be called Simply Enroll. This is a system that will allow you to streamline your Medicare sales, compare products side by side. You'll be able to see Medicare Advantage, prescription drug plan quotes, and you can also submit electronic applications or send a link to your prospects, and they can actually enroll without you, and you'll get credit for the sale. In order to be signed up for the Simply Enroll platform, first of all, you must be appointed with carriers through the brokerage, and you must be certified and considered ready to sell for each product. And of those products you're ready to sell, we will code your platform so that you can't make a mistake and offer a product you're not ready to sell. And if you were to make that mistake in today's world, as you know, you could probably lose your appointment with that carrier. So the brokerage will protect you in that respect, and we will make sure and set you up in a manner that you will not be able to make that mistake. So Simply Enroll. You enter your client's drug list, you save the drug list in a secured, password-protected area. So what's the reason for this webinar? The Medicare Plan Finder changes, and that drug list ID I told you about is going away. So this gives you a chance to save your drug list in a secure, password-protected area so that next year or the next year or into the future, you'll be able to access your client or prospect's profile, make any adjustments required to their either drug list or pharmacy selections, and be able to help them with the programs that you offer in the most suitable manner for the years going forward. This information will be saved. You can streamline your Medicare sales, compare multiple plans side by side for things like Medicare Advantage, MedSup, and prescription drug plans, and send electronic comparisons to your clients quickly and compliantly under a secured platform. It's available cost-free to agents contracted through the brokerage. So we wanted to bring this technology to the market for you at no cost to prove our partnership with you and stand behind our service that we offer our brokers. Here's a couple of quick screenshots. I also want to invite you to attend a more in-depth, detailed webinar next Tuesday at 10 o'clock. If you're interested in learning more about this system, simply send me an email, mike@thebrokerageinc.com, and I'll make sure that you get the invitation to participate. But just very quick overview here. This is what your dashboard would look like. And as you can see from the tabs, you enter the first name and the last name in the profile. There's a scope of appointment, and each one of these different formats here are very much the same as the Medicare.gov format, as you'll see. So once you've added the person's profile information, it gives you the chance to either email them a scope of appointment, or in many cases, people just want to mail it. You can click in email or mail, whichever you prefer to do, and send them a scope of appointment. If they do this by email, the scope of appointment form will also be saved in your profile, in the client profile, and you won't have to worry about saving that for 10 years and worrying about where that paper is. So it'll help you to streamline your Medicare sales, like we said. You enter the person's zip code, much like you would at the current Medicare Plan Finder. You put in if they are eligible for any extra help, if they're a part of the Medicare Savings Program, or if they're a dual eligible, you would put that information in right here. Then you would enter the person's drugs, and I've entered just a few here so that you will have an example. If there are brand name drugs, it'll give you a chance to switch it over to a more cost-effective generic. For example, I'm working with a friend who called me the other day, and I put in his drugs, and I was shocked to find out that it was close to $20,000 a year. And he was also quite shocked and told me he was not taking brand names, even though he sent me the brand names. He was taking generics. So when I went in there and I switched all of the brand name drugs to generics, the $20,000 estimated out of pocket went down to below $2,000. So a 90% reduction. So again, making sure that you have exactly the right drugs, exactly the right milligram strength and frequency, and any acronyms behind the name of the drug. My recommendation, collect that information and make sure that people read it to you from their pill bottle. Get exactly the medications that they take. Enter these drugs. Again, the drug list will be saved. Then you can have a chance to pick whichever pharmacy. And as you can see here, they put up a map along with however many pharmacies are within a certain geo-access range. And then finally, you're able to compare the plans. And again, you can search by MAPD, PDP, or MedSup. You can see here the United Healthcare's Dual Complete was the #1 plan, even though this person was not eligible for a Dual Complete. I wanted to use this simply as an illustration for this webinar. So if you want, you could click on the plan details, and if you did, it will actually break down everything from what the premium is, the estimated cost, and in this case, the person was between ages 70 to 74, the estimated drug cost based on the 11 drugs that I entered in. And then you can even click on see estimate by month, and it will break it down month to month for every drug. So there'll be no question if you were to present this to a person or print this out for them, there's no question about how much they'll pay, which month that they will pay, if they're still subject to a deductible, if they're going to hit the donut hole or the gap as it's referred to, when they may or may not hit the third final catastrophic phase. Everything is broke down here in a very organized and meaningful fashion. Then finally, if you want, you can click on the Enroll button and immediately it will jump you into the online enrollment system. Let me stop right now and say, I know there are those of you that may be on this webinar that think, I don't do electronic enrollments, I only do paper, and guess what? I can appreciate where you're coming from, and if you want to send us paper apps, we'll scrub them just like we have for the last 40 some odd years of the company's existence. But I will tell you this, if you will please give this system a chance and submit your electronic enrollment for the first time, you'll find it is super easy. It's also much more efficient than paper, and you will find probably that you will never use a paper app again unless you are forced to do so. So please give this system a chance. It will greatly improve your efficiency. It will also improve your compliance risks. And of course, it will also free up time that you may be able to either A, enjoy your time during the holidays with friends and family, or B, you can go and prospect and sign up more people. So, is there anything being done to express our concerns, and will the old Medicare Plan Finder system be preserved? There are a number of other organizations out there, for example, the National Association of Health Underwriters, that are sending letters to CMS and specifically Seema Verma, who, as you can see here, is the administrator for CMS, to express their concerns about these Medicare Plan Finder changes. We also found another letter that has been sent to the Center for Medicare Advocacy. The following organizations have supported this: the Justice and Aging, the Medicare Rights Center, the National Council on Aging, have sent all of these letters to Seema Verma in a similar manner. The message is the same, expressing concerns about the timing of the Medicare Plan Finder changes, as well as the HIPAA risk that it presents, not only for Medicare beneficiaries, but also for people like you that are out there trying to help enroll people during the AEP. So as a member of the Medicare Working Group, I've been involved with this since about 4 Fridays ago when Medicare came out and had a webinar that announced these Medicare plan changes. So we are deeply involved in collecting feedback and also shaping the policy going forward. So if you have any feedback, I'm happy to accept that, and I encourage you to call or email me with any opinions or feedback that you may have. Specifically, we are asking for people to be able to access their old drug list throughout this AEP. We want them to also be able to print their drug list, but as we speak right now, that drug list is going away at the end of September. We're concerned about the ability to see pre-authorization and drug limits. We were told that this would be ready by the AEP, but we are not being given any assurances that this is going to happen. We have expressed our HIPAA concerns, as I mentioned, so have several other organizations. And the carriers are also worried about agent participation due to the new requirements and complexity. So I've heard from a lot of agents already who say, you know, I depend on the Medicare Plan Finder. It's how I handle all of my drug quotes and make recommendations, even if it's for a product that I don't recommend. Well, if that's the case and the Medicare Plan Finder is going away, then how are you going to help people? And again, I think that Simply Enroll technology that I shared with you a minute ago is one part of the answer that you should consider. And CMS is really stuck on their point here. They're not going to return to the old way of doing things. So pretty much it's what it is. So there will be inaccuracy in Medigap information, Medicare supplements, due to having no dialogue between CMS and the states, because keep in mind, CMS does not regulate Medigap plans. And mymedicare.gov will have a live chat feature to assist with technical issues only, so they're not going to be answering benefits questions. CMS is also ramping up their call center. I hope so, because they're going to be very busy with a lot of people calling in this year. And CMS claims that they are not trying to run off the SHIP counselors, agents, or brokers. CMS has been getting a lot of feedback from stakeholders like you about this plan change and the poor timing involved. And the local SHIP counselors say that they're preparing people to drive them to the 1-800-MEDICARE. No disrespect to the folks at Medicare, but we all know that there's a possibility you can call them and get one answer, and then you can call them a couple of minutes later and get another person on the phone that gives you a different answer, which is exactly why you are an important part of the solution. Again, I've said it many times, but the more complicated things become, the more necessary you and your good advice becomes. New enhancements will continue to be added during the AEP. So in conclusion, we need you to make your voice heard. We need you to express your concerns to any and all of the organizations that may influence anything going forward. And consider this. We appreciate that CMS's efforts to update the Medicare Plan Finder tool and the 2020 marketing guidance was designed to better aid Medicare beneficiary decision making. We say that all the time. But however, we are concerned that recent revisions may instead complicate these efforts to the detriment of people with Medicare. Accordingly, we urge you and also CMS to closely monitor the rollout and functionality of the new Medicare Plan Finder tool, and encourage CMS to take steps to prevent beneficiaries from experiencing any negative consequences due to these and other changes the federal government is introducing into the upcoming fall open enrollment period. So in conclusion, to further ensure people with Medicare are adequately protected, we urge CMS to make immediate changes to the 2020 Medicare Plan Finder and rescind the updates either in full or in part. So the final comment, as the AEP nears, we encourage you to contact CMS or any other local SHIP counselors that are involved here with helping navigate for Medicare beneficiaries during the AEP, and reflect on the ways new procedures are decided. So I want to thank you for your participation. We wanted to at least give you an idea of what was going on, how this may impact you, and help you to better prepare for the AEP. As I mentioned a minute ago, we're a part of the NAHU Medicare Working Group. We're also a part of the FMO Advisory Council, and we are getting a lot of feedback. We encourage your feedback. We want it. We need it. And if we don't say anything, then basically this is the way it's going to be, and then we'll just have to react to the changes. Either we make our voices heard or we don't. If we do, maybe we can influence some of the change, and hopefully it will better the cause for all of us involved in the AEP this year. So again, thank you for your participation. I look forward to your feedback. Y'all have a great weekend.